Jody, so you were a fourth-year medical student? So you just saw a patient who came in with shortness of breath, and I will be listening to your presentation, and I will give you a feedback on how you do with your presentation skills. Is that okay?
Yeah.
Okay. Go ahead.
So Mr. Smith, that's the patient. He's here because he's short of breath, and he's 65. And this started about 2 weeks ago, and he's been waking up short of breath at night, and he had something like this maybe 6 months ago. He was admitted and he was put on Lasix, and then he got better, and then he doesn't have chest pain or nausea or vomiting. He doesn't have any headaches or fever or chills. And then on physical exam, his vital signs were okay. His blood pressure was a little low. It was like 100/60. And I think maybe he had JVD, but I'm not really good at that, so I don't know. And then his heart sounds, they were okay. There weren't any irregular sounds, and he was in sinus. His breath sounds were diminished, and I think there were crackles at both bases, which makes sense because on the chest X-ray, there was fluid. He has edema in the lower extremities bilaterally. They go up to about the knees. It's pitting. I didn't feel his liver or spleen, but I don't know if I really can do that because I'm not really good at that. And then I think that's it. His blood work, it was all normal. His CBC and his BNP, that was normal. His BNP, it was high. It was like over 1,000.
And do you know his medications list?
Oh, yeah. He takes metoprolol. He takes lisinopril. He takes aspirin and Plavix. He takes Zocor, and then he takes ranitidine, and then he takes Xanax. He takes Abilify. He takes Lexapro, and he takes Prozac, I think.
Oh, what did he he hasn't been on his medications for a couple weeks because like I said, they've been traveling. And then he says that this feels a lot like his heart failure episode 6 months ago, so that's what they think it is. So that's why they came to the emergency room. I knew his dad had heart problems.
So what do you think is going on?
I don't know. I think he could have heart failure. It sounds like, but then he could have pneumonia too because he's been coughing, and then they've been traveling, so maybe he has a DVT and a PE, and then he could have a liver problem too with the swelling in the legs. Sometimes you can get that, but I think it's probably heart failure, but I'm not really sure.